Good evening, everyone. On behalf of CII, I welcome Dr. Navin Sakhuja and all our viewers. Dr. Navin Sakhuja, MD, DNBE, is an alumnus of Maulana Azad Medical College and the prestigious All India Institute of Medical Sciences. He has worked in AIIMS as a senior resident and is recipient of the Best Residence Award. He has numerous publications to his name and is also a member of the American Academy of Ophthalmology, the All India Ophthalmological Society, and the Delhi Ophthalmological Society. His area of expertise is in cataract surgery, medical ophthalmology, and in techniques of dry eye management. Dr. Sakhuja is also an accomplished photographer with the Discovery Channel. He has written several chapters in various books and pursues both his profession and passion with equal zeal. Today, Dr. Sakhuja will talk about eye health during COVID-19 with increased screen time. We look forward to hearing from you, Doctor, and we'll follow it up with Q&A on chat or on Q&A. Over to you, Doctor.
Thank you very much. Thank you very much for everybody who called here to your CII function. And today I'm going to talk to you about a subject which is considered like an indirect fallout of this COVID. COVID itself does not have much effect on the eye other than a mild conjunctivitis. But one fallout that is being seen and is being noted world over is this increased amount of screen time. In any case, for the last couple of decades, we have had an increase in screen time. This increase in screen time has been not limited just to the working population, but to children who occupy close to 87%, young adults occupy 87% of their day by screens, some of them with double screens. Also, older population, your parents, for example, patients who have been recently introduced to, people who have been recently introduced to screens also have increased their screen time a lot in the last few decades, and much more so. There's a 90% increase in your screen time in the last couple of weeks, basically because of the fact that we've been locked down. So in this overwhelming, in any case, there's this overwhelming period where you're all going through a lot of trouble. What I'm going to talk to you a little bit about your eyes, and I'll now go to share screen so that I'll show you the slides that we are talking about. At the end of this 15 minutes, you can ask me whatever you want to ask me. So here we start. Can you see the slides? Is the slide visible? Okay. All right. So we are going to talk to you about your eye health during COVID. Specifically the effect of increased screen time. The broad outline is we will talk about computers in you, a little bit about dry eye concepts. I'll just touch upon coronavirus and the eye, you and your contact lenses, and a little bit about your children and ocular hygiene. Now, when you use your screens, almost all of you have the similar questions to this. That are the screens bad for the eyes? When we use it for very long hours, is it possible that they damage our eyes? How bright should the screen be? Should we put on dark mode to protect our eyes? Why do your eyes feel so tired by the end of the day? Is there any protection one can use? Is it better to use it in dim light, or is it better to use it in a well-lit room? And are there any rays that come out of the eyes of the excuse me, of the computer which might harm the eyes? Now, before I start anything about computers, I want to explain to you a little bit about the tear film. Most of you know that tear film has a little bit of water that trickles out when you're upset, or water that trickles out when your eye is irritated. But it is not just water. To understand this, understand that the eye is, think of the eye as something like a highly polished car, or as a piece of glass. But to keep it healthy and to let that glass remain clear and not become the consistency or the sort of texture of ground glass, it must be kept moist. If it's not kept moist, it will start looking like ground glass. So you understand that through ground glass, the quality of your vision will be completely hampered. So to keep it moist, there are 3 layers to the tear film. The base layer is one of mucus. Mucus functions like a shampoo. That means if you put shampoo on the car, the water is allowed to spread on it. The middle layer, which constitutes 90% of the tear film, has sodium, potassium, chloride, magnesium ions, lots of antibodies, sugar. It is what nourishes the eye. But The most important layer that you need to know about is the third layer called the lipid layer. Lipid is a medical term or a technical term for fat. So this is basically a layer of oil. Think of it as a layer of oil, and it's a layer of oil on the tear film, which is always there. This layer of oil, which is there on the tear film, prevents the tear film from evaporating. If this layer of, if this layer of oil is not stable or is not perfectly in place, the tear film will become unsteady and unstable. Now, the oil layer is secreted from these glands here. These small glands that you can see here, there are about 60 to 70 of these glands, which are in the lower lid, and about 30 to 40 in the upper lid. The way these glands function, I'm going to show you a small video which you'll understand. Basically, when you blink, the two lids touch each other, and the touch allows the oil to come out because it kind of squeezes it out. Something like those old glue bottles that we used to use when remember the ones with the red rubber tops, which you had to squeeze to take the glue out. So each blink functions like a squeeze. So dry eye broadly is divided into two types: an aqueous deficient dry eye and an evaporative dry eye. Aqueous deficient dry eye, we will not go into in great detail. It's a medical condition. It's very severe. It's associated with autoimmune diseases. It constitutes barely 10% of the patients of dry eye, and it is much more difficult to treat. The more common one, which large numbers of you have, and even your children probably have to some extent, is a condition called evaporative dry eye. Now, what is evaporative dry eye? It's quite clear by the term that it means that you're evaporating faster than you should. And why is it evaporating faster than it should? Because of this, because of meibomian gland dysfunction. There's a dysfunction of those oil glands. Either the orifices are obstructed, or the oil has become very viscous and become thick, or the oil secreted itself is lower in amount. Whatever it is leads to an unstable lipid layer, too much evaporation, thinner water layer, and thereby lead to a chronic dry eye. Now, what are the triggers for this dry eye? What makes these glands become uncomfortable? Or what is the single most important cause? Is screen time. Now, how does screen time, what is it? Why should your eye become dry in front of a screen? What is it that in facing a screen that your eye should become dry? This is the reason why the screen becomes dry. There's because of blinking. Now, for this, you need to understand that the screen is not radiating anything. The screen is just a piece of light which you're staring at. The problem is that you're staring and you're staring and you're staring and you're not blinking. It's like a hypnotic state. You are hypnotized by that screen, by the data that's on it, or the entertainment that is on it, or whatever they may be on it, is a hypnotic state. And because it's a hypnotic state, the blink rates drop. Blinking drops, the meibomian glands are not able to secrete enough oil. Oil is not secreted, the eye gets dry. So that is the single most important. Close second comes prolonged contact lens use. Now, those of you who have children or people in the house who wear contact lenses, you will know that they put them on in the morning at 7 o'clock in the morning and don't take it off till 2 o'clock at night. Now, that kind of prolonged contact lens use also dries the eye out. The contact lens contains 55% hydration, 55% water. That is a constituent of a lens. So, where do you think it gets its water from? It gets it from your own tears. Air conditioning, heaters, blowers, easy to understand why they cause evaporative dry eye. Previous LASIK and cataract surgery, 95% of patients who had LASIK surgery ultimately end up with borderline dry eye, and some 60%, 55% of cataract patients also have a little bit of dry eye. Now, this point, which all of you, I'm sure, all of you who have checked in are going to disagree with me, is on frequent washing of the eyes, because your grandmothers have told you that if you don't wash your eyes frequently, they will go bad. But actually, excessive washing of the eyes is not good. An occasional time you wash the eye, that's fine, but washing the eye actually dries out the mucus, dries out the lipid layer, dries out the water layer, and therefore effectively increases the dryness, in addition to the fact that it can also precipitate infections. Certain medication like anti-allergic medication, antidepressants, with vitamin A also actually will dry the eye out. Allergic individuals will have a little bit more dryness. And here I think I should also cover a little bit about blue light. Blue light is a component of light, also in presently invisible light, also comes out of the screen, which is why the dark mode of your iPads and phones and all that, you will notice have a yellowish tint, but it cuts out blue light. Blue light has a role in your sleep patterns, in stimulation of melatonin. So as a result of that, you know that people who use excessive amount of screens at night find it difficult to sleep. That's possibly from blue light stimulation. So therefore, now you will find that those who've been an optician recently, that they're talking more and more of putting a blue light protector in the spectacle. We use blue light protective Intraocular lenses for cataract surgery I've been using for the last 10 years now. Now, what are the symptoms of dry eye? Symptoms, basically, this symptom means what you feel. Grittiness, redness, irritation. I'm sure all of you are feeling this sort of symptom off and on. Blurring of vision, headaches, some amount of swelling of the lids, excessive watering. Yes, watering can be a feature of dryness because the eye goes into overdrive trying to produce more water. A foreign body sensation, and these symptoms you'll note will aggravate by the end of the day. Now, this is the kind of picture that happens. So I was trying to explain to you about the granular cornea, that this is the way the patient will see when the eye starts getting dry. And after putting a little drop, the picture will clear up. So dry eye prevalence, close to, just an interesting fact, 10 million attendances in eye clinics worldwide. 10 million attendances in clinic worldwide are for dry eye. So this is a small video just so that you actually understand what I just talked about. It will take me about 15-20 seconds. Just watch this for 15 seconds.
The primary components of tears, mucin, aqueous, and lipid, combine to create a complex viscoelastic structure. This complex structure is responsible for a multitude of important functions. Lipids prevent evaporation, lubricate, and stabilize the tears. Meibomian glands at the margins of the upper and lower lids produce and inject complex oil into the tears with each blink. This thin layer of oil prevents tears from evaporating and increases lubrication and comfort. Additionally, the phospholipids found in this oil stabilize the tear layer and improve cohesiveness. In a healthy eye, tear production is carefully balanced and controlled. Excessive evaporation of tears can stimulate overproduction of the aqueous component. This chronic overproduction of aqueous may be linked to eventual inflammation of the lacrimal gland. The symptoms of dry eye can include feelings of dryness, grittiness, burning, ocular tiredness, and discomfort. The oil produced by the meibomian glands becomes increasingly cloudy and thickens further to a paste-like consistency. On manual expression, these properties, as well as plugging of gland orifices, may be evident. As the condition worsens, eyelids display signs of inflammation and dilated blood vessels. With dry eye, sensitivity to environmental factors like wind, temperature, and humidity increases. Interference with normal vision may become noticeable. Often, the individual considers it part of the normal aging process, when in fact, dry eye can have a significant impact, causing loss of productivity and poorer quality.
So, right. So, right. So now, when we've got these, after at the end of this video, I'm sure you understood how the eye and the tear film functions. So how do we manage this dry eye? So we would broadly divide this into the home remedies that you can do, and there are procedures that one can do to rectify dry eyes. One is, of course, screen time. Now, this point I want to emphasize a little bit for 2 minutes, because you see, everybody is talking about screen time all the time, and you will be jumping down your children's throats saying, reduce the screen time, and it leads to those horrific fights about screen time. Now, think of screen time like your diet. You have a chocolate lying in front of you, and you have a carrot lying in front of you. All of us know which form of calories are the better form. It is much better to have the carrot. But once in a while, you do have the chocolate, and it doesn't kill you to have the chocolate. So similarly for screen time, I would put this, you have to have a diet of your screen time. It is not that all screen time is bad. A lot of screen time is essential, and whatever I may say and explain to you, you still have to get involved in your screens. So screen time is important from the point of view of your work. Screen time is important for you from the point of view of your socializing sometimes. And for children also, I mean, they have the same sort of life as you. They also have a social life, and they also have work. So they need some amount of screen time. You can cut down on the unnecessary screen time and maybe give your eyes a little bit of rest. So you have to be a little judicious about the screen time is what I'm trying to get at. Now, for this, one rule that you can follow is called the 20-20-20 rule. The 20-20-20 rule means that every 20 minutes for 20 seconds, look at an object which is 20 feet away. So focus on a tree, or something which is far away, just look at it. It allows the blinking to kind of normalize, and the normalized blinking then makes you feel a good deal better. Dietary advice is a sort of, for vegetarian diets, you can use, basically what we need is omega-3. So flax seeds and chia seeds help a lot, as does for the non-vegetarians, salmon and all the oily fish, sardines, mackerel. They are good forms for omega-3, and you can also have it supplemented orally as an omega-3. Hot compresses. Now, hot compresses really form the mainstay of management. The hot compress is done by using a hot towel, either wet heat or dry heat, and pressing the eye for about 8 to 10 minutes. Now you have to understand that the glands are located on the inner surface of the lid, so hot compresses don't work as effectively as procedures that we can do for you in the clinic and make you feel significantly better. But they still are a good method to kind of think of that oil that is inside your glands has actually become butter. So what you're doing by the hot compress is making it oil again and gently massaging the lid and allowing the oil to come out. If you try the hot compress even now, today, you will find that within minutes of doing the hot compress, your eye feels a lot better when you're focused on the screen. Certain medication like anti-allergic and antidepressant medication will also increase the dry eye. You have to limit your contact lens wear time and of course, avoid washing the eyes. Now for those patients where the home remedy does not seem to work, there are procedures. There's a new procedure called the Lippy Flow, which is a wonderful spa-like treatment. It is completely painless. It takes exactly 12 minutes to do. We can't do it in longer or less. That is the amount of time the computer takes to do it. It just gently massages. Think of it like a massage. It massages the lids and thereby cleanses the entire lid out. Has an effect for almost 12 to 14 months. It's completely office-based. It has zero downside. I mean, I've done it in my own eye. I did it in one eye to see how much better it made me feel. The only sort of downside of it is that it's an expensive procedure. With that, I want to talk to you a little bit about coronavirus. Everybody wants to know whether coronavirus can affect the eye. There is a mild kind of, it's called follicular conjunctivitis, which is bilateral, both eyes, and patients can get a mild conjunctivitis with dryness, with coronavirus, sorry. But it's not common. Only a very few small percentage of them actually get it, and few of them do shed the virus in the conjunctiva. Therefore, there is a risk for both the patient as well as the doctor when you're examining patients of conjunctivitis now who might be COVID positive. Now, where contact lenses are concerned, significant numbers of you must be wearing lenses, either you, your children, a lot of family members. And this contact lens wear basically is of two types, either cosmetic or therapeutic. And cosmetic means that you're wearing the lens to basically, to just sort of, it's for cosmetic purposes. And the other is therapeutic. Therapeutic means where the doctor is asked to wear the contact lens. Basically, you need to wear a good quality contact lens, reduce the duration of wear. These days you get excellent lenses which allow the eye to breathe, give you better oxygenation. And you must maintain very, very good hygiene when you wear lenses, about washing your hands and both when you put the lens on and take it off, because the complications of contact lens can lead to blindness. So please do not forget that they can lead to blindness. A lot of times I'm asked, when can we start lenses for the children? I don't like to start them before puberty because children are not really able to handle the lenses well. There are certain issues that you need to sort of know with children. I've already talked to you about screen time. I'm sure these are going to come up in questions that what do you want to do about the glasses? There's very little one can do for their glasses. And washing the eyes we've been through, screen time, and role of eye exercise. Eye exercise, common misconception is that eye exercises are going to kind of, reduce the number. It does not reduce the number. It is only done to strengthen the muscles so that the patient does not have headaches. And headaches are common. You'll find that children will come and say that their eye and their head seems to ache after break time. So that is an indicator that there sort of something is wrong with their eye muscle balance. So basically this is about it. And so in conclusion, just want to say that sort of don't have too much. There is always some fear of the unknown. Really speaking, I'm not talking about the corona right now, I'm talking about the screen. The screen also a new unknown. We are all worried and we think that, is it really going to cause how bad is it? It is something that you need to be judicious about and need to sort of be sensible about, but it is not going to sort of destroy something for you. It will just aggravate the level of comfort in your eye. So with that, now I'm going to stop the screen share and please feel free to ask me whatever you want to ask. Anurag, back to you.
So, doctor, there's a question. The eyes can also be weakened due to poor quality lighting that we put ourselves through, during our calls and other meetings online. What do you recommend to reduce such cases?
See, a couple of things here. Firstly, eyesight itself does not get weakened by your eyesight. The number that you have and the power of your glasses that you have in your spectacles, that is not really affected so much by the screen, right? What is affected is that one is your muscle balance, because your eye muscles tend to get really tired when you're on the screen, so you end up with headaches and discomfort. And the reason why the vision becomes blurry is because it's drying out, as I showed you in that little slide. So one, you must do some exercise like the one you do in yoga, where you look at a pen or bring an object closer and closer to you, sort of focus on that object to strengthen the muscles.
And since you spoke a lot about the drying of eyes at such times, what do you recommend, at times like this when we are sitting at home and we have no approach to a doctor for a home remedy for dry eyes?
Give yourself some hot compresses.
Which is easily available.
Yeah, give yourself some hot compresses. Re-wet and re-lubricate the eyes regularly with any good quality lubricant. And in addition to that, you can also do, especially for children, you can do a little bit of exercises. Somebody here called Masuda was just asked about doing, because the children are using a lot of that Kindle, a lot of TV, they're doing a lot of online work on schools. So for those children also, of course, cut down as much as you can, but make them do a little bit of exercise. That will help a lot of their headaches. So the exercise I just demonstrated to you once, so very easy for you to understand. Can you see me? So you take a pen, bring the pen closer and closer while looking at the nib and not letting the nib become double. So you bring it right till here, count to 10, and then take it away. So that what it does is allows the eye muscles to strengthen a little bit.
So you just said that washing of eyes is good, but not too much. So somebody's asked a question that why then after crying a lot your eyes burn instead of they're feeling better, they become red and they become irritating.
See, when you cry a lot, or when you cry, it is not regular just tears that are coming out. There's a change in the concentration, change in the osmolarity of the tears. Sometimes they become more hypertonic, they're more salty. There's a complete change in the ratios between the mucin, the lipid, and the water content, and that is also accompanied by little inflammation. You notice that the eyes also become red at that time. You're crying a lot, they also become red. So every time you get further exposed to that salt water, that the eyes will burn a little. It's normal. Nothing abnormal in that.
So somebody's asked a question that he's in his 40s and he is facing this problem of eye floaters. So what would you suggest?
Yeah, that's a good question, Ashok. That basically is when you see floaters, they are not coming from your screen. The floaters are coming in. Basically, when you say that you see floaters, you need to have your retina checked. So you will need to go to a doctor, get a retina checked because it requires dilation. And floaters are sometimes indicating of a retinal issue. So you have to have the floaters is not something you can do, and they're not coming from the screen.
And what would you suggest for the kids who are, perpetually either they're doing classes online, or they are on the computer playing games, or they are watching television? So for kids, what would you suggest for keeping the eyes safe?
See, one, I would suggest that for one, it is important that you have to make them exercise a little bit. Exercise, one is exercise of the eye and exercise outside. Because there was a study done on Australian second generation Chinese student from Australia and one from Singapore. And it found that Singapore children had a higher incidence of eye numbers. And that was attributed to reduced amount of outdoor activity and indoor activity. So you have to increase their outdoor activity as much as you can, or in these days, occupy them with something other than the screen. And then, of course, if they're complaining of burning, re-lubricate them a little bit with some mild lubricating drops and do the exercise.
So could you suggest some mild lubricating drops or some eye drops which at such times people can just put?
Standard over-the-counter drops that you get, like Refresh Tears, they're very good. They're good drops. They contain low levels of preservative. So they are good drops to use on a regular basis.
And visually impaired people, face a huge challenge in such times when physical contact is not possible with their helpers and it becomes increasingly difficult for them to work. So how can they be better suited to deal with such challenges?
This will depend on what sort of visual impairment we're talking about. Is there any specific on this? Can whoever's posted this question can ask me specifically what you want? So what visual impairment they're talking about, then I tell them what they should be.
So not really specific, but generally.
Say elderly patient with severe visual impairment, or sometimes have retinal issues and things like that, they can't use much screen anyway because they can't see the screen. So they will have to stick to, other activities, playing cards, or someone reads out to them, or music and things like that.
So somebody's asked a question like, you visit your dentist regularly at an average of say 6 months or maybe every 4 months. How many times should you visit your eye doctor?
That's a good question. See, for children, ideally you should come once in 6 months. Adults, once in a year is enough. And the elderly population, again, once in 6 months, because you don't know, are they developing a cataract or they're developing some kind of retinal issue. I can't hear you, Anurag, you're muted.
In times like these, how you as a doctor are dealing with the constant fear of the virus, and how do you keep yourselves mentally strong so that, you always might be having this behind your mind, that you are susceptible to the virus yourself when you're dealing with any patient?
Definitely, we're more susceptible to the virus than what the regular person on the street is more. We are more susceptible, no doubt about that. But I think most doctors take this quite pragmatically, because we've been doing this for so many years, and there have been so many inflammations and infections and so on that have come on in big epidemics in the past. I remember when we were interns, there was this big epidemic of encephalitis. Many of our friends in hospital ended up with encephalitis, and I think one or two had a fairly serious situation. We have to just take the precautions like the way it's been advised, and go through it the way it is. So even now, like, I don't see patients these days, routine patients, but if there's an emergency, if someone's injured his eye, or someone is suddenly got, well, let's just talk any kind of emergency, then I do see them. It's not like I don't. So someone has asked dosage of omega-3. Nandita has asked dosage of omega-3. Omega-3 dose actually for adult dosage is 1000 mg a day. So the tablets, some of the tablets that are coming in are 500 mg tablets, some are 1000 mg tablets. But 1000 mg a day is the oral thing. But omega-3 also, you need to also have a little bit of consultation with your physician, because patients if you have major liver disease or something like that, there are certain patients in whom it's not allowed. So always clear it with your physician.
So is there any age, there's a question, is there any age that is suitable for a laser treatment, or maybe what is the age limit till which you should get a laser treatment and beyond which you should not?
There is no age limit for on the beyond part. Otherwise, younger age group, definitely not less than 18. 18 is absolute, less than 18 is absolute no. I don't even do it before they're 20 actually, because I want the number to completely stabilize before you take them up for any kind of surgery. The number should be stable. See, basically the number is rising till they're about 18, 19. So once the number is on the rise, and you take the patient up, the patient will end up with the number later, because the laser is not preventing the number. Laser is just rectifying what is currently there. If you're -4, the laser will remove -4. But if it's written here that you're actually going to be a -5, then you end up with another -1 next year. So wait for the number to stabilize, that's one. Second thing is that patients over the age of 40 usually don't do well with the laser because they are beginning to get a reading number has begun. So that reading number it makes them more uncomfortable, let's say. It's not that they don't do well, they can still see, the procedure goes off very well, but they do have a little issue with reading after the laser.
And are there any newer technologies besides laser which can be also thought about?
Well, that's always evolving. There's laser, there is smile, there is I mean, there are a whole lot of newer procedures which you can't go into the depth at in this kind of a talk. But it'll depend. It has to be individualized for a particular patient. What that particular patient needs.
There are people who are who have numbers, but they start increasing beyond 30. So is this a normal symptomatic?
Can you repeat that question?
So people beyond 30, do their powers suddenly start increasing at a faster pace?
No, not after 30. Usually this happens after 45, 50. You can have a slight change in your power. You can have a slight change after 45, 50.
So do you see the virtual glass taking over the sunglasses after this COVID?
Well, difficult to say. You're muted again, Anurag. Anurag, you're muted.
In the end, what are some final tips, thoughts, comments that you can share with the audience today?
Well, basically, it's the same thing that, cut down on what is not necessary. Don't wash your eyes, please. Because washing the eyes, not only is it going to dry the eyes out, it may also put you through some kind of infection. You don't know what all is in touch with that tap that water has come through. There is no need to bring that water into contact with your eye without unnecessary. If some foreign body goes in, it's a different thing. Cut down that is not required. Give yourself hot compresses. Hot compresses help a lot for this for dryness. That should more or less be about, I think, other basic ocular hygiene. And take care of yourself.
So, any more questions?
Are there any more questions anybody has? I don't think so, is there?
So there is one question, what is the proper way to wash your eyes?
Well, there's no proper way. You just sort of kind of use water and wash it out, maybe boiled water if nothing else, and don't overdo it. While if you don't need to.
So I think we can end the discussion here. Thank you so much, Doctor, for your time and for your valuable inputs of taking care of our eyes during this Corona period.
Yeah, you're welcome, but I'm just answering someone's question. Well, thank you very much for having me here. It's been a pleasure to talk to all of you. And if there's any other questions, feel free to let me know.
Thank you very much.
Thank you very much.